Hey everybody, it's Liquid Lunch on it's a Wednesday today. Beautiful day, it's kind of cooled down a bit, and beautiful summer. It's been a good summer, Dr. Josh.
Yes. Simple as that. I don't pay attention to the weather versus like the next day. Was it hot? Was it cold? It's nice.
No.
It's great to be outside.
It's really good.
The energy's good. So yes, it has been a good
Last
summer.
year wasn't so good.
I can't remember.
Yeah, it was a little cool, but this has been a perfect summer. But anyways, today we're talking about, we're standing.
We are standing. Have you ever stood in Liquid Lunch? For the whole...
No. This might be a first, you're right. Yeah.
I like bursts.
So that's good. So I hope it works out.
Can you see us? Seems to be okay.
So we're talking about posture today.
We're talking about posture again today. So when I was here in May, just coming back from Italy, I had commented on seeing so many bad postures, but I really didn't get the time in that conversation to go into the short and the long-term consequences. Mm-hmm. You know, everyone knows if you look at, check out the images, people know what good and bad posture really is. Mm-hmm. That's the unfortunate part, but people also know what healthy food and unhealthy food are, whether they take action.
Yeah, well, I was just going to say, the thing is, you know good posture or bad posture when you see it, but you don't see yourself.
You don't walk around with a mirror.
So
Correct. Correct.
So you don't really know what your posture looks like to other people or to yourself.
Yeah, and until you are trained or educated to be aware of what that posture should and can look like, I find myself, because at my height there, and the basement of my current home has a few low spots. There are the shifts that are not very often. So when I pass by on a sunny day, on a nice summer day, that reflective window, I'm checking my posture out constantly. Yeah. Not looking at how do I look and what I'm wearing.
Narcissism. Okay.
No, it's healthism.
Yeah.
But I'm checking to be aware. Like, I know standing here, I am now in a much better posture.
You just gain height, right?
And we all can. People will ask me when they're under care, am I going to get taller? Is it? Yeah, maybe. Yeah. There's not that that guarantee or promise in a chiropractic setting, but people always feel taller because they actually think I stand up straighter and more aware. So think of the workspace and again why we're standing during this conversation versus love the couches, but it's hard to demonstrate while sitting down. You said, I got to get me one of those Swiss ball chairs.
I like that.
And what you missed, which a lot of people do, is she's using this stability supported natural chair poorly.
Yeah.
She's slouching her back, and I know my father-in-law is not watching this, and I love him dearly, but I watch him on the couch just slunk into this big cushy leather couch, and I just want to pick on him more. But he's super active, and he stands quite tall overall. It's people get into this slope and this slinky posture. You see it on the subway. Kids playing their games, and they're just in this C shape as opposed to a more upright.
Like these people.
Even worse than the people in that corner. They're the animated kid not sitting on a tall stool, but they're in that position. We talked about you getting a brand new Aeron chair and that not being the best thing, but not being a bad thing.
It's comfortable.
And comfort is important. You don't want to sit there in an uncomfortable, wiggling around all the time.
Yeah.
I think we touched on, a standing and a sitting desk. The whole shift to a standing desk isn't, the best thing. It just means that you have the chance to get up and down. I can't remember, but I probably said that the treadmill desk, if it was more cost economical, would be the best.
Treadmill desk?
The treadmill desk.
What is that?
Haven't seen it?
No.
Oh, so I
think
they're setting up a big standard size desk on a treadmill.
So you're actually walking?
I know a friend who's he's a cantor with synagogues and he's in New York now, but he has a treadmill desk. So he's walking while he's doing his work. He's got his computer up there. The Ellen DeGeneres show mocked one. They had wind and they were throwing stuff at this person. It was hilarious as a bit, right?
Well, because I was just thinking that's what they should do on the national now. They should transfer from the standing to the treadmill news.
And you hear people, someone's discreetly pushing the speed up button or the incline, but to be in motion while working would be awesome. and they aren't, as economically cost efficient as even the standing desk. So, whole other conversation. But you see a few examples of people in usual settings, from a young age to a smartphone time frame to being at work. Love these two pictures are just two people in a different chair on the same desk.
Mm-hmm.
Can you have the next slide, Chris? The reality is the consequences of not watching your posture over the long term is that the spine starts to become more degenerative. It breaks down and starts to go into a fusion and scar tissue and arthritic state when left alone long enough. And I was looking at x-rays of two people yesterday to my report who are part and parcel really rounded over. The one lady was in the middle example of the how heavy is your head, and this gentleman who was in his 60s, had his pretty intense life before, and said he was quite daring. I don't know if he was a stuntman or not, but daring a lot of guitar. With his x-rays, which I should have brought but didn't, he's just so rounded, and for the time being he's stuck like that. Now we're going to start working together, and my goal is to get him as upright as possible. It's going to take time. When I see a little kid who might have a slouching posture and they get a few adjustments, they might immediately self-correct and stand up straighter. This gentleman might need 3 to 4 years of consistent and consecutive chiropractic care to support and enable his habits to be stronger. He is stuck here, and even if he tried to stand up, his spine would resist.
So he's like
He's like the third version there,
guy.
and while it's slightly cut off the flexion addicted society, he's got that much of a rounded spine, and his neck is sticking way forward versus the normal posture when the head is literally up here. Actually, I'll use you as an example.
Yeah.
So,
Bad example.
is it correct? So we all have that slight shift.
Yeah.
That's in 80% of people.
Yeah.
Yours is on the lower end of that, so 2 thumbs up there.
Very good.
But just try sticking your neck forward and close your shoulders in.
Like forward?
Yeah, kind of down. Dropping your arms, but try to be a little more upright.
Okay.
Come back down. We'll just find, and relax the shoulders now to a more natural spot. So there are tons, as in millions of people who walk around in this moderated posture. Bring the shoulders back. Stick that neck forward a little more still, and let it relax there. See, yours comes back, which is great.
Okay.
Your neck comes back, but I see people, and as you mentioned, I see people, and they're here. Their head is in front of their shoulders.
I've seen that, and you see that walking down the street.
I see that in my nightmares.
I've noted that for my whole life, right?
Which is a bonus that you see it.
Yeah.
A lot of people don't see it. So, next slide, Chris. So the short.
What causes that? Is that just sitting wrong, like maybe?
That's a handful of things.
Yeah.
It can be sitting wrong. It takes time.
Yeah.
That's not an overnight thing.
It's really just the bad habits accumulated over time.
It can be bad habits. It can be trauma. So one of the other people last night, the woman who was, again, mid-60s, much more degenerative spine. Go forward for a second, Chris, the last slide, and I'll come back. So, I should have centered that one. But if you look at the bottom right where it says advanced osteoporosis, wrong language, but best image I could find, when you see the change in the bottom right versus the upper left, and the white bone versus that translucent, transparent disc, you see all the extra bone growth and degradation, and things get, there's shrinkage. How many older people do you see that you suspect were probably taller 20 years ago?
Probably all of them.
A ton of them, right? And
Yeah.
tons of people shrink. The discs degenerate, the bones degenerate, they compress. That can be bone density. That can be poor posture over time. That can be bad sitting. That can be, being a hardcore guitarist. That can be trauma. So this lady said in the late 80s she had a major car accident, where that type of acceleration, deceleration, back a slide, thanks Chris. That type of acceleration, deceleration whiplash can throw the spine into a reactive or protective position, and people either don't get the right care, or they don't get any care. They felt fine, or their pain got dealt with, and they end up with this fused spine. Back for me, Chris. Thank you. So, what people do forget about is the impact on the rest of their function. You have a bad
Right.
spine, you have bad posture. We've talked about this over the many years we've known each other. There's compression and pressure on the nervous system on the inside,
And it's the main communication highway for your whole body.
which is what this lady relayed to me yesterday. I'm like, she gets it, it's awesome. It's the highway between brain and body. So, I get people coming in when they've had chronic postural subluxation misalignment issues. They've got inflammation in the spine, they've got carpal tunnel syndrome, they've got issues going on in the extremities, or they've got sciatica, topics we've talked about this year, right? Outside of that, people who have this posture, the research and evidence out there has stated there's an increased correlation to higher rates of morbidity, earlier death, more people dying based on heart-related disease.
Oh, even heart.
And I don't have a laser pointer, but we look right there at the base of the neck, top of the shoulders, the core organs getting their nerve supply there are the heart and lungs. People in this posture have bronchitis issues in their later years. Kids will have more asthma sensitivity. We'll see people with high blood pressure, with irregular heartbeats. People who have, especially women, with their neck forward, or there should be a normal forward arc. They lose that. Bless you.
Thank you.
Thyroid issues, because the thyroid gland gets its direct nerve supply right from the base of that spine. And I've seen plenty of thyroid scars from a thyroid surgery, cancer surgery,
yeah.
or it's hyperfunctioning, it's hypofunctioning. When we talk about posture, and when the spine loses its ideal posture or alignment, again, short term there might be pain. Short term there might be the aesthetic part. There's the, I should stand up straighter because my mom said, and I shouldn't ignore her for the rest of my life. And when people don't realize it over time, and in the text-neck smartphone generation, everyone is already setting their way forward. There's going to be more laxity, looseness in ligaments in the muscles that should hold people here. This is the next caveman, and we don't want to go back to a caveman
That's right.
posture.
We had the ascent of man,
And the descent of man will be huddled up, working on a tablet or a smartphone, going back to a small. And we can laugh at it too, like it's silly and funny. But I see people suffering all the time.
Yeah.
And I'm not trying to make a
Right.
downtrodden topic. Your posture is so critical. It can be, while there is contrary research to stomach sleeping being bad versus good. I've had a colleague who recently published an article talking about the neurological research of having a better neck curve by doing some stomach sleeping versus back or side with a proper pillow. People who sleep on a big poofy pillow that
No.
pushes their head up, bad.
I don't like that.
Neck support. Some people lay flat when they sleep. They don't have a pillow. That's not a bad thing either. Being on one side, you can sleep like this on a tiny pillow, or like this on a too large of a pillow, or something right in the middle. I'm still a proponent for back and side, but I'm very curious about what's being said with respect to stomach sleeping and putting the neck into more of a extended state, even if it's turned. That's the question in my mind is, you're sleeping on your stomach and you're here. Yes, it brings your head more up, but what about the torque?
So that might be okay. Like if
It might be, but I'm not saying today to start changing
see,
to a
if
stomach
I
sleeper.
do that, and I do that sometimes,
Yeah.
but then I don't have a pillow,
Noted.
right?
Noted.
Yeah.
And there's still that, what type of potential torque depending on your flexibility and the range of motion that you have naturally. On the long term, I see people suffering. They have poorer health, whether it's again heart related or lungs related. This posture leads to more headaches. It leads to more fatigue. It leads to vision issues. It leads to chronic sinus problems. Issues where this part of the spine is either rounded or twisted and torqued again from trauma, sometimes even emotional. A lot of more women, and I think I've talked about this, young girls develop, and those who become more voluptuous will spend their formative teen years not sticking their chest out, right? It's common, it's natural, and they stay that way. And all of a sudden they're 25 and right, I have terrible posture. Other people, from an emotional standpoint, are triggered into having a protected posture. More emotional, nothing physical about it. And I see those postures, they start early, and they really they restrict the spine. And I'm working with people of always of variable ages and variable spinal status. And I've seen those who've had that stuck position, and it's taken, I've known them for over 15 years, slowly but surely with yoga, with postural awareness, with spinal traction, and the word traction's a heavy one, but I use high density foam wedges, whether under someone's neck or thoracic spine or the lower back, to put the spine into a more positive posture. So there's lots of things you can do to correct that. You're not stuck with it.
And I'm just thinking, because this is so important, because you're saying that we might just think it's posture, but what you're saying is it can affect heart health, lung health, in fact, probably the health of most of the organs in the body.
As you said, it is the highway between brain and body, and we forget that. You know, we think, oh, if my teeth are yellow, you know, I just need to make sure they're clean so I look all nice. You think of, you know, tooth decay and gingivitis and teeth that eventually fall out because someone doesn't floss enough. Something as small as that, like I should floss, I'm too tired and too lazy, and they'll have major dental issues just from not flossing, even if they brush furiously.
Yeah.
So if you're not aware of your posture, even though you know it's not bad or you're working on it, there are bigger impacts with respect to the nervous system, with respect to your organs, with respect to your natural function. Correct.
You know, I'm just, you know, this, as we've already said, this is the first time we've done a standing interview, and there's something very unique about doing a standing interview with a chiropractor, you know, because I'm conscious of my posture the whole time. I'm standing up as straight as possible.
Yeah.
And what I'm finding is that I can feel my, this is an example of what you're talking about, I can feel my, I guess my sinuses and stuff like draining. Do you know what I mean? Just because I'm consciously standing with as good posture as possible, and I can feel it's having effects on some of those other functions.
Nice.
So my question is, what percentage of people have less than optimal posture?
Oh, what do you think?
Probably pretty high. I'm thinking 80%.
Easily. You know, and again, I compare and contrast when I see personal trainers, when I'm in a gym, when I see people who are coming out of a gym, I see people who spend a lot of time inside of a fitness environment, and I just see that, you know, the strength of their back and their heads, you know, way up high in a nice tall position. I don't see them very often. Mm-hmm. And again, I have to guesstimate based on who I see, as opposed to doing a, you know, heavy analysis. And the studies are out there, and knowing that 80% of the population is plagued by lower back pain, and that's going to take some postural misalignment, it's safe to say that 80% have a less than optimal posture without question. Some might just be teetering into a little bit of fix. Others, again, some of the people I see, it's offensive to my emotions that they got that far, but they didn't know.
And that's what we're trying to do today, is bring some awareness. So if 80% of the people have less than or more, potentially, have less than optimal posture, that means that really their overall health, their organ health, is going to be less than optimal as well. And,
correct.
But this is where, I guess, I mean, obviously you can evaluate someone's posture.
Nerve scans, postural assessment, x-rays, and I love when people like that x-rays, like, absolutely. I had a lady again yesterday. There was 3 great examples of new patients where posture was a factor, and the last one, she's a landscaper. That's her fun, that's her passions. I was feeling challenged from my passion for chiropractic and her passion for landscaping, and she was funny. And when she's working harder, she gets, you know, wrist and arm and hand issues that are coming from, you know, posture and structural deviation in her neck. So, I mean, it's out there. It's almost always connected to a lot of symptoms or dysfunction or health issues. People just don't know that connection of the nervous system inside that spine, working positively or working, you know, optimally or less than optimal.
Well, I can imagine that any landscaper out there has used a wheelbarrow,
and a wheelbarrow wouldn't necessarily be a bad thing if you carry it right.
If you carry it right, but
the time actually spent working on the ground, like the heavy lifting isn't really the issue.
It can be.
It
I
can.
had an incident with a heavy wheelbarrow once.
I have a lovely patient. She works in packing and unpacking. She's like, and I don't remember when we last talked about posture and lifting, but she's like, I do what you told me.
Oh yeah.
And I said, oh, we never went over that.
Oh yeah.
And then her daughter, who is 16 and spry, like she's kind of tiny and doesn't have a lot of strength. So let's make sure that you and your mom really get into that posture. But
Yeah.
I told the mom, and we had a funny moment of, I've never shown you that. Like, oh, I'm like, no wonder your back has been uncomfortable with all the heavy lifting. Legs, push through the heels. Legs, push through the heels. So you can lift something heavy, do it poorly, and have an incident without question.
Yeah.
But done right, heavy lifting isn't as much strain as just
Yeah.
the
As
back
long as you
posture side.
know your limit.
Yeah.
Like yeah. And be reasonable about it.
Correct.
Okay. Anything else we want to let people know about today?
Make sure you're checking your posture. Be narcissistic. Look in those windows.
Mm-hmm.
Be aware
Mm-hmm.
that it's okay to check yourself out to stand taller. I want to check what you're wearing, sure. But if you're here and you want to be up here, don't stand. You can take selfies and check from the side, but just keep aware of your posture as much as possible. If you're not sure if it's optimal enough, check with a chiropractor.
Yeah.
Physiotherapists are some of them are awesome in terms of helping someone with their posture. Just depends on what you're looking at getting done in the end. But just be aware. Posture, posture, posture.
Okay. Great. Now,
That's all I got.
If people want to get in touch, what's the best way?
AnnexFamilyChiropractic.com. Lots of online presence.
Oh, I don't know, Dr. Josh, but we have this wonderful
I had the
thing.
spine.
We haven't used it at all.
We hadn't because I was showing myself. Sometimes I get my hands active, sometimes having a spine on the side. Some of the postures we're talking about are not quite that extreme, but if this is, so from the side, not sure which camera I've got going on, but I think everyone's there. We want this, I'll just do a little spin if I can. It's almost perfectly straight. That's what we want. So I will see
Oh yeah.
these.
Don't want that.
Those are more nerve compressing than a lot. There's torsion happening and compensation happening, and one of the biggest zones of older people is this. You see that really rounded back. Sometimes that lower back comes in and it's more subtle. But these are some of the variations that I see where, again, as much as possible, as best as I can over time, we slowly want to bring it back here and keep it there.
Okay. Awesome.
Thank you for reminding me it was hiding behind me.
Okay. Awesome, Dr. Josh. Thanks, as always.
Pleasure as always.
Okay, great. Okay. Stay tuned. We'll be back with lots more here on LiquidLunch.channel.com.